And I'm going to start by asking everyone to get involved. So, can you guess how many YouTube videos were watched every minute last year? So we'll start off with a wee data question. I can tell you that last year, every minute, 4.5 million YouTube videos were watched. That's every single minute. Also, 188 emails were sent every minute. But what surprised me the most with this was the number of swipes Tinder users made every minute. 1.4 million? Really? Honestly? I'm missing out on something, the swipe motion. But I guess I wanted to start off with this just to give you a flavour of how much information is generated in the world around us. And this year with the pandemic, it's going to be phenomenal. I mean, you could triple the numbers that are on this visual. So I'm looking forward to seeing what happens to that when that comes out. Now, our focus is on increasing the healthy life expectancy and reducing premature mortality. And to do this, we use data, intelligence, and a place-based approach to lead and deliver Scotland's public health priorities. Scotland has the lowest life expectancy in Western Europe, and health alone is not the solution, and hopefully the next few slides will kind of bring that to life. Now, looking across the wider determinants of health and well-being, this is truly a multi-agency and multifaceted approach to support the citizens of our nation, and even more so as we're trying to do this in the middle of a pandemic. So knowing at the start of the pandemic that we had 680,000 households that didn't have basic Wi-Fi, 680,000 households in Scotland that didn't have basic Wi-Fi, they had to go into lockdown in the dark. So, but what I can say through the tremendous and valiant efforts of colleagues on the Connecting Scotland programme, we're making a positive difference to this. And that all inclusive, and in amongst that, you'll see I've highlighted education. Though it's highlighted as one of the facets there, for me and my journey in the last year has made me realise how important education across all generations is so vital to promote not just health literacy, if I can be biased from my health perspective, but literacy across all the aspects surrounded by this. With the pandemic, we've all been faced with many challenges. We all have in our own communities, in our organisations, in our personal lives. However, on the flip side, it's also given rise to multiple opportunities to do things differently, break, or in some cases, or in my cases, smash through boundaries and rigid protocols and bring together sectors through the power of data. Well, this is an example of some heat maps. So this is quite basic visualization. We're able to display areas of deprivation across different localities. Being able to see this at such a high level in this case allows us to see the sheer spread of deprivation and the enormity of the task at hand. So this visualization of different areas, so both pictures are in different areas, is deprived communities. So the deeper the red, the higher level of deprivation, and mapped against the least deprived communities. So in this case, the deeper the blue, the least amount of deprivation. And this forces us jointly to think about how can we redesign services to connect communities and truly blur the boundaries that exist between those that have and those that don't. We also need to tell the story through the service design, but able to support the delivery of improved outcomes. And for me, this has been the cornerstone of the last couple of years of my life, that no one has ever made a decision because of a number. They need a story. They need a story which pulls out your heartstrings and evokes the emotions. Scotland has a lot of data. I kid you not. Honestly, we have a lot of data. We don't really need new data. What we need to do is be able to decipher the insights in a lay term that makes sense to all of us, every single person in Scotland. And also, I have worked with, over the years, with so many talented analysts and data specialists that with others, we can work together to tell those stories with individual communities and help and support them collaboratively to design services. that are accessible and fit not only for today's generation, but also those yet to come. And our superpower is the difference of skills and knowledge that we bring to our virtual tables. And we all need to openly acknowledge that, as it's this that will build the improved nation that we all deserve, and importantly, that we need. What good is it to treat people's illnesses and then to send them back to the conditions that made them sick in the first place? And this is where a joint approach will be the foundation of what we need to support the attainment gap, to take people out of poverty and make sure people don't live in the dark ages. So I quoted, the 680,000 households that didn't have the basic Wi-Fi. Our joint purpose here is to support and co-create a successful country that gives opportunity to all people living in Scotland. And to finish off, to share my mantra and my superpower chant, as I like to say sometimes when the lights are off and nobody's looking, is together we are greater than the sum of our parts. The common theme I'm picking up is that together in smaller localities and communities, we can make a difference. Thank you.